Hi, my name is Thomas Hartmann, and I am a third-year medical student at the University of Central Florida College of Medicine. I'm here today to present our project titled Meatome, a novel plant for single-step urethral meatal stenosis surgery. I worked on this project with my research mentors, Dr. Sam Song and Dr. Hubert Swana. The motivation for this project was to develop a device that can more effectively treat patients with a genital defect called meatal stenosis. The meatal stenosis is a narrowing of the opening of the urethra, as seen in Figure 1, which inhibits the proper flow of urine out of the urethral orifice. It is most commonly seen in adolescent males, as one of the more common causes of meatal stenosis is circumcision. Trauma to the glans penis during circumcision can lead to collagen scar formation, which can create a meatal stenosis via narrowing of the urethra by the collagen scar. If left untreated, patients are at an increased risk for bladder and urinary tract infections, as well as bladder distension, and in more severe cases, hydroureters and hydronephrosis, depending upon the degree of obstruction caused by the meatal stenosis, as seen in Figure 2. The typical treatment option for this defect is via a surgical procedure called a meatotomy. Meatotomy is an in-office procedure performed with surgical draping, local anesthesia, and multiple surgical devices. The typical meatotomy procedure requires 2 or sometimes 3 critical steps: crimping of the obstructive skin using a hemostat, as seen in image B, incision of the obstructive skin using surgical scissors, as seen in image C, and then, depending on if crimping was sufficient in stopping the bleeding, sutures may need to be placed to reinforce the skin and halt bleeding further. Overall, the final result being widening of the urethral opening, as seen in image D. The major downsides to this procedure include the use of multiple surgical devices, leading to poor patient cooperation and an increased risk for potential complications. The aim of this project, therefore, was to create an all-inclusive device that can perform a meatotomy without assistance of additional surgical tools. In order to begin with creation of our device, we defined 3 major features that we felt our design needed to have. The first being a blade that could incise the obstructive skin, the second being crimping ability to prevent bleeding following incision, and lastly, a device handle that could allow for sustained pressure following clamping. Before revealing the completed final design, quickly would like to highlight the design of the blade and its relation to the crimping platform, as can be seen by the red arrow in the bottom left of the screen. As you can see, as the device goes from open to close, the blade is capable of incising and then subsequently getting encapsulated in the lumen of the lower jaw of the device, allowing for complete closure of the device and crimping. The final put together device can be seen here, with a centrally located blade embedded in a crimping platform and a handle with a ratcheting mechanism allowing for constant pressure to be applied. We then performed comparative studies with our 3D printed metal design against current industry standard tools. In our crimp testing, we tested the quality of crimping of a hemostat labeled 1, our device labeled 2, and a needle driver labeled 3, using molding clay to visualize the grooves and crimping quality. In addition to the crimping ability, you can also note the incision seen in lane 2 of our device, showing an incision mark, a feature unique to our device. In the second part, we simulated a meatal stenosis procedure using chicken skin wrapped around a metal tube, representing the lumen of the urethra. The procedural steps can be seen in image A to D, and with pre-cut seen in B, with a zoomed in image here, and the final result being seen in image D, again, with a zoomed in image here. In the end, the results we took from these 2 qualitative studies were that our novel device has comparable crimping efficacy compared to the 2 surgical tools, the hemostat and the needle driver. In addition, as pointed out before, our novel device was able to create an incision into the molding clay, a unique feature of our device. In addition, the simulation testing showed again the dual functionality of our device, with the ability to perform both crucial steps of crimping and incising simultaneously, resulting in an enlarged urethral opening. Future directions for our project include performing quantitative studies to further compare our novel device against industry standard tools. We plan to do this by conducting benchtop force measurement studies to assess pressure profiles upon clamping, performing clinical testing using ex vivo human skin, and ultimate goal being to perform clinical trials. Thank you for your time, and I look forward to answering any of your questions and comments you may have.